to Teresa Swist and Philippa Collins' presentation. Teresa Swist is an engaged research fellow at the Young and Resilient Research Centre based at the Institute for Culture and Society at Western Sydney University. Her research explores the intersections between youth engagement, health and wellbeing and emerging technologies, and she's part of the Wellbeing, Health and Youth Centre of Research Excellence team, which is looking to advance young people's participation across adolescent health and translation. Pip Collin is Associate Professor and Co-Director of the Young and Resilient Research Centre and a stream leader in the aforementioned Centre for Research Excellence in Adolescent Health. She researches the role... Sorry, the screen keeps changing on me.
Oh, I'm so sorry. I'm trying to work out which screen to share. Sorry about that. Do you want me to stop?
I've just completely lost your bio. I will have to just make it up. So Philippa Collin, co-director of the Young and Resilient Research Centre, a stream leader in the Centre for Research Excellence in Adolescent Health, a long time Living Labs advocate and practitioner, co-director of the Intergenerational Living Lab. Please be welcome, Teresa and Pip.
Thanks, Amanda. And let me just check now. Am I sharing my presentation screen? It looks like it's got the Young and Resilient one. Yeah, okay, sorry. I'm working across a couple of different screens, which means I can't tell which one I'm sharing. Okay, great. Well, it's lovely to, no, I can't do this, sorry. Oh, I couldn't work out a way to check this before our meeting. I'm so sorry. Okay, can you see that? Yeah. Okay, well, I mean, you know, like it's lovely to be able to have this this time with you all and to hear about the work that you're doing, and to be able to present with Teresa on behalf of all the young people and researchers who've been involved in the work that we're doing. And in some ways, I feel like this title should have a question mark at the end of it, because, you know, a lot like many other people in I think this all-in symposium, where we've been using a Living Labs approach, but we have a lot of questions about what a Living Lab actually is and whether or not this is actually what we're creating or whether we already have it. But in any case, the work that we're undertaking is part of the Wellbeing, Health and Youth NHMRC Centre of Research Excellence in Adolescent Health, which has been established in order to promote research and translation that helps us to create health services and care that work for young people. We currently have the largest population or youth cohort ever globally, and in Australia, young people make up 20% of our population, and yet they're you know, a severe disadvantage when it comes to the healthcare system. And we see these disadvantages, particularly because our healthcare system is really designed for the very young and the very old. And we can see the disadvantage that young people experience principally through, you know, the increasing prevalence of chronic disease, and poor mental health, despite the incredible investment and advances that we've been able to make in the first 1,000 days of life. And this is really despite the fact that for many, many years, internationally, organisations and advocates have been calling for youth participation to really be at the centre of adolescent health research and translation. And so in order to sort of reimagine what health services could be in order to work for adolescents and young people more generally, the Wellbeing, Health and Youth CRE is really being established in order to investigate how do we do engaged research that is ethical within all of the emerging opportunities and challenges of the digital age. To do this, we've really adapted the an intergenerational approach to applying Living Lab's processes that we've been developing at Western Sydney University for a number of years. So with my colleagues Amanda and Girish, who unfortunately couldn't be here today, it's really thinking about how do we bring together young people, researchers, policymakers and practitioners to engage in ongoing and situated process of co-research, design, testing and trialling and application in order to transform the health policies, the health systems and services and practices that young people receive. And that's really been the focus of our foundation project for the Wellbeing, Health and Youth CRE. So we've had 3 phases of work in order to establish this, to co-investigate and to establish a living lab for wellbeing, health and youth. The first phase was really to co-research and co-design with young people, policymakers, investigators, of course, and advocates. What are the sorts of conditions, constraints, and possibilities for establishing a platform for young people's ongoing participation in adolescent health research, and really trying to shift the dial from sort of bringing young people into research and design processes once the problems and the research projects are defined, and thinking about how we engage right from the agenda setting process. The second phase was to really establish what we've called the Wellbeing, Health and Youth Commission, and to recruit our first 20 commissioners who are diverse young people who have been in partnership with the CRE investigators and our other partners, establishing really the agenda for the Wellbeing, Health and Youth Commission to work on, focusing on training and induction, including around health research, messaging and communication. And phase 3 has really been a process of us kind of rolling out this model at scale, so to speak. One of the first outputs of this process was a wellbeing, health and youth engagement framework. And this is a framework that's designed to support researchers and other stakeholders who wish to engage directly with young people in health research and translation, to adopt a framework that can, or to adopt an approach that centres young people's roles at the very heart of their processes. And what the framework is intended to do is enable these stakeholders to engage in 3 particular steps or processes, if you like. The first is really to identify the values that can enable young people's meaningful participation in these processes, to work with questions that help to guide their processes and practices in translational research, and also the sorts of practices that can enable and support researchers, policymakers, professionals and others to work effectively with young people. Now, 2020 was really our year for sort of trialling and testing the framework. And of course, everything was really unsettled by COVID-19. But at the same time, I think what it did was sort of amplify for us the demand and the importance of supporting health researchers, policymakers and professionals to work with young people in this way. In a sense, one of our big challenges has been to establish some very clear boundaries around how we navigate the requests to work with the Commission and to work with the Youth Health Living Lab. But what we've focused on in 2020 was, in a sense, 4 core capabilities of the Wellbeing, Health and Youth Living Lab. The first was to build capacity, and not just to build capacity with among young people to work with researchers and others, but also with researchers and policymakers. The second area was really to advance the design and to help to navigate some of the ethical dilemmas of adolescent health research in a digital age. And there were a number of key projects that we worked on with the commissioners, including an ongoing piece of work around emerging technologies, which Teresa will talk about, but also crafting some major proposals for research in response to COVID-19. The demand for young people to be involved in co-design and co-creation processes is huge, and what we've wanted to do is to really shape the ways in which different stakeholders think about the role that young people can play in advising and co-creating, particularly policy and services. So for instance, we worked with the Australian Institute for Health and Welfare to inform their indicators of youth health that shape their next decadal report on youth health, and shifting away from them receiving feedback from young people about what it is that they're focusing on to a process of online and offline workshops and co-writing processes with the AIHW to inform their indicators and to shape that report itself. And the fourth area is really thinking about, how do we support young people and the researchers and others who work with them to generate and utilise evidence that helps them in their own advocacy work. And we've really focused in the last 12 months on advocacy that is conducted through the media, through our own web presence, and indeed sort of identifying, working with young people on the kinds of advocacy pathways that they would like to forge, but making sure that we're also, when we're working to translate some of the research and evidence that we already have to governments and other bodies, that we're co-authoring those submissions with young people.
An example we're sharing today of how we've been utilising the Living Lab process is a sub-project called Co-Creating Digital Health Futures. As you can see from the aims, the focus is upon emerging technologies, embedding young people's needs and aspirations, plus a real desire to inform future research agendas, projects and interventions. Even before the pandemic, we were aware of the need to better understand technology in relation to adolescents and healthcare. And the pandemic amplified this need and raised additional questions about how digital health is understood, designed, and delivered. In terms of methods, next slide, please, Pip. The methods used in this sub-project evolved through an iterative process involving the Why Commission. The findings from the literature review were explored and developed with young people with a particular focus on their perceptions of emerging technologies, how they view opportunities and challenges related to their health and well-being, plus their thoughts about methods to explore or research possibilities to explore these evolving practices and issues. And one of the methods identified, which is future scenario planning, then became the focus of a workshop with commissioners that has generated 3 scenarios about the future of healthcare to help identify issues and possibilities which can inform present day decision making. These scenarios will be shared and refined with young people and CRE researchers to inform agendas, projects and interventions. So in terms of outputs, this iterative and generative process has generated a briefing paper, which has a conceptual framework to help explore emerging technologies, opportunities and challenges, plus implications for health research with young people, as well as the development of 3 scenarios about the future of healthcare, which will prioritise young people's needs and aspirations in the creation of future health-related products, systems and services. as well as agendas, projects and interventions through and beyond the pandemic. And these outputs will be available on the Wellbeing, Health and Youth and Young and Resilient websites in due course. In conclusion, our experience to date has highlighted some of the benefits of using the Living Lab approach to advance adolescent health. In particular, the iterative, ongoing and collaborative approach has helped us to facilitate an open and inclusive process, which is really about fostering a different relationship between young people, researchers and end users of research. It's also helped us to embed experimental and design qualities in terms of the process, and also to support multidimensional outcomes. Along with benefits, we have encountered challenges. In particular, it's a complex and ongoing process to ensure that researchers and other stakeholders are skilled in and able to effectively collaborate with young people within this sort of broader context. In 2021, our focus will be on embedding the Living Lab approach in wellbeing, health and youth work, as well as scaling and also making the capabilities of the WIRE Commission available in and applying them in a sustainable way to other initiatives, projects and organisations. If you're interested in finding out more, please check out the WIRE website for more information about the initiative and the WIRE Commission. As well as, please obviously feel free to get in touch with us, and we look forward to your questions.
Thanks, Pip and Teresa. Fantastic work. It's really, really wonderful to see young people participating in these processes. Fantastic. Does anybody else have a question for Pip and Teresa? So, shall I have another go while you're all being shy? Look, I think one of the really interesting questions around Living Labs is the question of labour. You know, living labs require a lot of labour from members of our communities, our citizens, however it is that you define the end users that you work with to co-design solutions, or solutions, as we heard earlier today. And basically, yeah, I'm just wondering if you can talk us through how you're thinking about young people's labour in this context. So how you're valuing that. I mean, it's clear how you're valuing it, but you know, how do you compensate young people for their time? How do you acknowledge the effort that they're putting in, and have them understand their value in the process? And also, I'm interested in the question of labour from the perspective of, you know, the effort that's required to engage young people meaningfully. So the effort that you're making, I guess, to make sure young people have that. You know, what have been the key challenges for you?
Yeah, thanks, A3. I mean, for me, this is sort of like one of the key ethical questions for Living Labs, full stop. You know, I mean, obviously, you know, we and possibly, you know, everybody else on the call has an interest in, yeah, in what we might call social living labs as much as anything, you know, like labs that have, you know, social benefits and social outcomes. And therefore, you know, necessarily need to engage with oftentimes those members of the community who have the least resources, who face the greatest barriers to, you know, participation and so on. And certainly, I think children and young people are one key group within that. And we've also been very, very interested in this work to think about which young people we're looking to engage with. So not just young people who are already what we would call consumers of health, but also those who still have a stake in the health system and in healthcare and in health outcomes nevertheless. So it's a really, and then, you know, like, which obviously goes to your question about what is it that we're asking of them? What is the benefit to them when, you know, like, it might be much further down the track, but like, what is the immediate benefit versus the time and effort that they're putting in, often when they're you know, they have extraordinary you know, constraints and other demands on their time. And of course, young people are already, you know, some of the least well-resourced members of our community who are, I think in general, there's kind of like lack of recognition about the resources they require or have at their disposal versus what we think is going to be the benefit to them of giving their time to these processes. So it's something that we think about a lot. I think the other part that and you know, like there's a simple answer to your question, which is when we recruited the commissioners, we recruited them on a kind of a retainer basis. So we pay them for their time over a 12-month period. And we also look to pay them for their time when they work on particular projects, especially because they're often doing that work with paid researchers and, you know, local policymakers and so on who are also being paid for their time by another entity. But there's another layer to it, which I think is something we're learning a lot about, which is, I mean, in the specific entity that we're working with, and we're working with people who, you know, are from health and medicine and other, you know, broad domains of work, who I think really believe in the principle of youth participation, but actually it's not built into their ordinary routines and everyday ways of doing things. And so there is like additional work to be done, I think, by young people to skill those researchers and other stakeholders in understanding how they can shift their processes and practices, their ways of thinking, you know, whether it's about, I mean, the classic example is that researchers often come up with a research problem on the basis of the existing evidence base or their, you know, program of work. And then they go to young people and say, well, do you think this is a good idea? How can we do it together? So there's actually a lot of work there. And I think we're working really hard. And it's one of the reasons why Theresa and I were talking about the need to think about what sustainability looks like in a lab from the perspective of the, you know, all of those members of the quadruple helix, including especially the community participants, the citizen participants. Yeah, our strategy is to work that through with young people themselves, to ask them what do they need, how do they want to receive it, and to regularly check in with them about it. But it has to be resourced and funded, and that is a big challenge.
Thanks, Pip. Theresa, do you want to respond to
thank you. Adding to what Pip was saying, very early on in the process with the workshops with young people, which informed that framework of engagement. As part of the process, we also worked with the young people to develop a partnership model, and that ended up having 4 or 5 features where young people highlighted the ways they would value sort of communicating with each other and researchers and being part of the process, the types of ways they might like to be sort of reimbursed, or what value they see in being part of such a project, and also the type of activities that I'd ideally like to be part of. And what they valued was things like, say, a reimbursement for part of their time, but they also really highlighted the other things they really valued about being part of this project, such as the networking and the learning, and really wanting to sort of share their skills and capabilities. So I think that is really something we'd like to develop more as we go forward, to maybe return and reflect on that partnership model and to sort of tweak and revise it with them to see where it can go further in sort of the next iteration